ठीक है
Hello friends, myself is Shalini Bharadwaj. You are watching ITV Networks Medically Speaking. So today we are going to talk about the herd immunity. Right now we have with us the panel of doctors, Dr. Samiran Panda, who is a scientist and head of Epidemiology and Communicable Diseases Division from ICMR. Our another guest is Dr. Narendra Saini, who is microbiologist and former General Secretary of Indian Medical Association. So, sir, welcome to Medically Speaking. So my first question goes to Dr. Narendra Saini, that is related to herd immunity. Sir, what does herd immunity means? What is exactly herd immunity?
In simple word, herd immunity means that in certain population, if they are infected and they have antibodies. Antibodies are those which are against that particular virus or particular bacteria. And if they become around 60 to 70% people get infected with that and they have antibodies, it means virus, particularly virus which can survive only in the human body, they do not have any place to go because it will be difficult for a virus to find another living organism where they can grow. So that is constituted as a herd immunity. And if 60 to 70% scientifically it has been proved, if 60 to 70% people get infected and have antibodies, then slowly and slowly that disease goes away. Then it doesn't remain as a pandemic. They may remain endemic, but it will not spread to others. That is called a herd immunity.
Dr. Samiran, how does it work? Basically, if we talk about that, herd immunity, how does it work, especially in COVID cases? Does it going to work? If there is a herd immunity, then cases will be reduced.
The transmission of the virus. Here we are talking about SARS-CoV-2. That is the virus which causes COVID-19. So, for this virus to get transmitted, the susceptible individuals need to come in close proximity to those who are infected and who are able to transmit. So now if there are barriers in between, like I am infected and I'm able to transmit the infection, let's assume, while speaking or through coughing or sneezing, and I have somebody in my close proximity, vicinity, who is susceptible, then the infection transmission takes place. So this is the way the disease or the virus gets transmitted. So now between me and that person who is susceptible, if there are 4 or 5 more people who have been infected and have developed antibody, or have been vaccinated and have developed antibody, then there is a barrier between me and the person who is susceptible. So that's the way it works. And when we talk about herd immunity can be obtained through natural infection. We get naturally infected and then we developed neutralizing antibody against the virus which stays in us for a while. Or herd immunity can also be obtained through vaccination. So if we vaccinate sufficient or a number of people or a critical mass, and let's assume that 70 to 80% people have not been vaccinated, but in a community, let's say 30 or 40% people have been vaccinated, 30% people are using masks, 30% or 40% people are maintaining proper physical distancing during social interaction and maintaining hand hygiene, along with that using mask. So it's like multiple barriers which are working between the infected person and the susceptible person. So it's all about building a barrier between the infected individuals and the susceptible individuals. So herd immunity is all about that.
That means some or the other way people are taking precautions, whether it is vaccination or we can say people using masks, sanitization and other things. Dr. Narendra Saini, do you think because the latest Sero survey says that near about 50% people have got herd immunity, do you think Delhi is moving towards the herd immunity?
If that data is correct, I do not know what is the sample size. That sample size has to be sufficient in the sense that it should be covering different areas of population. sometimes we do not know how the sample size has been taken, whether it really, I can say, it represent a daily part or not. If that statistics is good and people are maintaining, as Dr. Sabha was saying, that if we are taking other precautions as well as, and people are taking vaccination, so we are reaching towards thing. And luckily we are seeing, because I have my lab which we are doing COVID testing also, I am seeing the number of cases are drastically reduced. For the last 3 days, touch wood, I have not found a positive case. We are doing around 40 cases per day, but I don't find any positive case in that.
That's
That
really
is a
good.
good thing. That, yeah.
Sir, if we talk about that, do you think that, what should be the next course of action for the city to control COVID cases? Dr. Samiran, what would you like to say, sir?
I would say that let us not assume that India as a country has reached herd immunity. The data came from Delhi. And as Dr. Saini very rightly pointed out, we need to look into the data in depth in order to see what is the exposure rate in the urban slum setting, in the urban non-slum setting, and the rural setting. When we say 51% of the Delhiites have been infected, is it for entire Delhi and is it homogeneous? Or it is in the urban slum where the population density is much more, you get to see, a higher percentage infected and already able to develop antibodies. If you go to the urban non-slum setting, it will be far less. And then in the rural setting or in the peripheral areas, it could be farther less. So I would say that let's not get into this idea that India has reached herd immunity, which says that 70 to 80% of the people in a community get infected or get vaccinated. Vaccination has not happened to that extent. So let us talk about natural infection. So no, majority of the Indians now are vulnerable to the SARS-CoV-2 infection. So what is the next course of action? We should not lower our guard down. We should not do that. We should be maintaining the mask behavior or the mask mandate, as we call it, and mask use behavior, particularly during daily commuting in the trains or buses where the physical distancing is impossible to maintain. So in that kind of situation, use of masks become much more important. Secondly, the physical distancing during social interactions. Again, we cannot, take it in a very relaxed manner. No, we have to adhere to that kind of principle. And hand hygiene. Now we have a good news that vaccines have also been added to this list of prevention tools. So all these are a comprehensive prevention package. So it's not just one prevention. Like even if we are getting vaccine, we should have other elements of prevention package also practiced. And then only we'll be able to stop the chain of transmission of the virus.
That's so important. Dr. Narendra Saini, I would like to know one more thing that, sir, reluctance towards, COVID-19 vaccine can be a kind of, a barrier for the, if we are moving towards the herd immunity. Do you think that, people are still hesitating to get themselves vaccinated? What do you say?
Yes, I think it's a very good question asked, and I think this program should be highlighting the importance of vaccination. It should be creating awareness about vaccination. We must, whenever we get an opportunity, we must vaccinate ourselves. At present, government is giving free of cost. We must utilize this. We are talking about herd immunity. We are talking that we want that this pandemic should go away. We want that our normal life should come. This is only possible when we get ourselves vaccinated, as we were talking about, Dr. Panda was also talking about, if we reach towards herd immunity. And one of the way of reaching towards herd immunity with safety involved is this one. And I must tell you, I'm the one who got myself vaccinated. It is now 3 days and I have no symptoms at all. Even I was hearing that people are complaining of pain somewhere or nothing. Touch wood. Along with me, my staff was around 10 people. We all got vaccinated and there was no problem with me. And please do not create an issue of co-vaccine or Covishield. Let this scientist and government should decide about it. Once they have come out with all scientific evidences. Leave these to them. Whatever the government is providing us, whether Covishield or Covaxin, we should feel ourselves fortunate that we are getting this facility, and get vaccinated yourself. This is the only way and the fastest way of reaching towards herd immunity. Besides, as Dr. Panda was also saying, having a mask, keeping a safe distance, keeping your surroundings clean.
So it is very important to take all these precautionary measures, and the people who are still waiting for themselves to get vaccinated yourself, because it is a very important. But you should not think that, you know, the COVID-19 is over, because this particular virus is completely unpredictable. So keep yourself vigilant and keep yourself updated about the COVID-19 and take all the precautionary measures. Thank you so much, sir, for joining us on this panel.
Thank you.
Thank you, sir. Thank you.